Afternoon. Thank you all for joining us today, and welcome to the Advocacy 101 webinar. My name is Jerica Mathis, and I am the Director of Health Policy at the Society for Public Health Education. On behalf of SOPHE, we are pleased with the interest in this event and are thankful that you have taken time out of your workday to participate in today's session. I'd like to cover some housekeeping items. If you experience any technical difficulties with the event, you can obtain technical support during the session by calling the number on your screen. From our main presenters, we will have a question and answer session with the time remaining. Questions can be submitted at any time during the webinar by typing in your question box on the right-hand side of your screen. Feedback and ask you to complete the feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program will assist us in planning future webinars. Today's webinar is being recorded and will be archived on SOPHE's Center for Online Resource and Education at www.sophe.org/education.csm within 2 weeks. Education has been approved for one Category 1 continuing education contact hour. This program is designated for Certified Health Education Specialists and Master Certified Health Education Specialists to receive up to a total of one continuing education contact hour. For those who choose to apply for credit, please visit SOPHE's core and create a free core account. Continuing education fees do apply, $12 for national SOPHE members and $24 for non-members. As an introduction, SOPHE is a nonprofit organization founded in 1950 dedicated to providing global leadership to the profession of health education and health promotion and to promote the health of all people. This includes more than 4,000 health education professionals and students throughout the United States and 25 international countries. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of 20 local chapters, and its numerous partnerships with other organizations. SOPHE provides global leadership to the profession of health education and health promotion by stimulating research on the theory and practice of health education, supporting high-quality performance standards for the practice of health education and health promotion, from face-to-face meetings and distance education opportunities for professional development, and advocating policy and legislation affecting health education and health promotion. SOPHE for Online Resources and Education serves as your one-stop portal for e-learning, virtual engagement, and continuing education tracking. This integrated learning management system provides access to content for professional development and career advancement for health education and health promotion professionals. This is to earn continuing education credits through webinars, journal self-study, meeting casts, and online courses. Keep up the cutting edge of education with CORE by visiting www.sophe.org/education.csm. We are also pleased to announce the launch of SOPHE's Career Connection, a new online resource designed to help you find the best job opportunities in public health education and promotion. SOPHE's new Career Connection provides free and confidential resume posting, access to the National Healthcare Career Network, a growing network of over 290 healthcare associations and professional organizations, quick search and save capabilities, including automatic email notification of new jobs that match your criteria, easy job application, apply to create a password-protected account for managing your job search, and a discounted job posting rate for SOPHE members. I invite you to join us for the 17th Annual Health Education Advocacy Summit, which is why most of you are on this webinar today, which will be held February 22nd through the 24th here in Washington, D.C., and please also save the date for our 65th annual meeting, March 19th, 1st of 2014 in Baltimore, Maryland. You'll be able to see the objectives of today's webinar on your screen. At the end of this webinar, participants will be able to define advocacy and health policy and demonstrate how to form a relationship with policymakers. To announce our two speakers for today's webinar, Christy McClary King and Ime Opoko. Dr. Christy King is Assistant Professor and Program Director for Public Health Education and Community Health in the Department of Health and Sports Sciences at the University of Louisville in Kentucky. Dr. King is the principal investigator on several multi-year research studies that focus on the improvement of children's health, specifically through school community-based physical activity and nutrition interventions and policies. Dr. King serves on local, state, and national health advocacy committees. She collaborates with communities to educate their decision makers on local, state, and national policies related to public health. Dr. King earned her PhD from Southern Illinois University Carbondale, completed with postdoc training in physical activity and public health research with the University of South Carolina's Arnold School of Public Health and CDC's Prevention, and she's also a certified health education specialist. Ms. Bell is a first-year community health master's student at the University of Louisville in Louisville, Kentucky. She earned her bachelor's in health and human performance with a concentration in public health education in May of 2013, where she received Outstanding Student in Public Health Education Award in addition to achieving the Dean's List for her excellent academic performance. She advocates for public health at the individual, social, community, and policy levels by wearing a variety of hats. Her university position as a nutrition navigator allows her to serve as a liaison between University Dining Service, SODEXO, and the University Health Promotion Office, advocating for healthy meal options for students in the campus dining halls. Amy also serves as an advocacy coach for the Kentucky Teen Institute, partner of the Kentucky YMCA. She supports high school students statewide, along with their teacher mentors, in conducting community assessments, identifying influential community members, developing strategies to implement interventions, advocating for health policymakers, and ultimately influencing legislation and policies impacting health throughout Kentucky. She continues to meet with state-level Kentucky legislators and policymakers to discuss the results and implications of her research in which she's involved as a student at U of L. You participated in last year's Health Education and Advocacy Summit with Dr. King and will also participate this year in D.C., which will be her second visit to D.C. Health Advocate. With that, we'll turn it over to our speakers for their presentation.
Christine, and this is Ime Apoko. Hello, everyone. We're sitting here in my office together. Okay, let's get started. So here is a fun picture of Ime and I right in Washington last year at Ime's first advocacy summit, and that was my second, and the coming year will be my third. So today, this Advocacy 101 session is very basic. We have 6 objectives. We'll describe the coalition coming together for our trip to Washington. We'll review the definition and purpose of our advocacy efforts. To prepare for our summit before we come to Washington, I'm going to describe what we do while we're at the summit. We're going to describe a typical meeting on the Hill, where Ime and I will walk you through one of our actual meetings we had last year. And then we will describe what types of follow-up communication we had since then and other types of communication that you can have continually with your policymakers. On the right are pictures of us at the summit last year. That's Ime, the first student, and then Clayton Coleman was a student who participated last year. He's now a Fulbright scholar, so he's in Cyprus advocating for public health, and myself. And the bottom picture is Ime and Clayton not texting and driving while they were on their way to Washington last year. So I want to stress the importance of phenomenal and important it is that this coalition of over 30,000 voices are coming together to advocate for public health and public health education to our national leaders. As we know and have studied, a coalition is a formal, multi-purpose, long-term alliances, and there is strength in numbers. So different organizations that are represented at this summit will be SOPHE, obviously, American College Health Association, American Public Health Association, the Directors of Health Promotion Education, American School Health Association, Eta Sigma Gamma, and several others. Some of us will be coming to Washington as individuals, and then some of us will be representing our professional organizations. There is strength in numbers, and we bring with us a variety of perspectives. Over on the right, you'll see a picture from last year of over 220 summit participants in Washington, and I believe there were 38 states that were represented. At the bottom is my first year at the summit, myself and a colleague in California that I met, and we've continued to build some strong networking and relationships around advocacy. So this opportunity to come together in Washington is phenomenal. Okay, Amy.
Okay, so I'm up to bat. So here we have a slide on the ecological approach to improving public health. Great thing about our profession is, as health educators, we can really impact people at every level. It doesn't have to be one or the other. So here at the bottom, starting left to right, we have a few pictures to show how you can use this approach in your career. So we have a young child here who is engaged in an after-school physical activity program. So it's the importance of starting children off early, giving them the knowledge to be able to build healthy lifestyles, as well as the attitude to want to do so, and then the skills to go out there and then a healthy lifestyle. So really it shows beginning at the individual level is where it all begins. So a personal example for myself is I work as a wellness coach for a smoking cessation program. So I was first talking with the individual to see what their goals are, to even want to begin trying to quit. And if they don't want to, why is that? So it's really theory-based, trying to go over the stages of change. So then move on to the interpersonal level. So at this level, we have supportive relationships, things that will help you be able to lead a healthy lifestyle. So down here at the bottom, we have a child here who doesn't look like he has the healthiest of lunch. So it's not just the individual problem, it's a bigger problem that can be addressed at an interpersonal level, organizational level, community, and then even higher up on the scale of the society level, where you can implement acts to take care of healthier meal options at schools. Moving on, we have this community-based approach here to show that it's more fun if you can get out there and find other individuals who are also interested in these health activities that you want to be a part of. So along the lines of social norms, is it normal for you to want to get out there and garden? Is it part of your culture? These are all things that are part of, taking into account the bigger picture of how we can get people interacting in health behaviors. And then the picture here, we have a wonderful picture of Dr. King. She's modeling how to ride a bike safely with a helmet here. And so this goes all the way up to the society level. Do you have a bike-friendly city? If you don't, what can you do about it? Chances are you'll have to go a little bit higher on the scale to the society in order to get laws in place for well-lit streets or well-lit sidewalks in order for you to be able to even want to bike ride if that's something you choose to do. So overall, it's a great way to show how together all of these different levels help facilitate a bigger picture of leading a healthy lifestyle. Okay, we'll move on to our next slide here, which is the 7 areas of responsibility for health educators. So really, we are all supposed to be able to do these things, but for the purpose of this presentation, we're going to focus on area number 7, which is communicating and advocating for health and health education. So this here is how to form your message in a way that it can reach a wide audience of people. So you're not going to be talking to just one kind of audience. You'll be talking to children, legislators, lay people. So you really have to be able to form your message and advocate for health and health education in a way that everybody can understand and then take back to their own communities and spread the word. Okay, so we thought it would be very helpful to include a slide along the lines of how a bill becomes a law. So a lot of us have probably had some kind of background information about how this is done. It might have been a while, so we'll just give you a little refresher. So here we have an example at the state level, which it can then basically be applied to the bigger picture of the national level. First, you'll begin with a bill being drafted and introduced. Then the next step is it's sent to the appropriate committee. So an example of a committee could be the Health, Education, Labor Committee, if it's some kind of bill that's related to health. So the next thing that will be done is looked over and then sent to the floor to be voted on. So at any time, they can either say yay or nay, if they like it, but if they don't necessarily agree with everything that's in the bill, they do have the opportunity to kind of mark it up and make some changes to it. So it's passed with amendment, it will return to the original House, then they can then decide if they agree or disagree with it. If at the floor point it is passed without any amendment, it'll then go to the governor or the president, in which they will then decide if it will become a law. So typically most bills become a law around January 1st of the next year. Then we have a picture here that we included, which it has President Obama signing off on the Healthy, Hunger-Free Kids Act of 2010. So this here was actually his first act that he signed off on related to health once he did become president. And not too familiar with this act, it puts in place caloric restrictions for healthier lunches, which once again illustrates, the ecological approach of how the society can then go further down to then affect the individual at a level. So together, it's just not one big thing, it's all these things together that can help make sure that everyone has the opportunity to lead healthy lifestyles. Okay, so this here is, a very important slide. So in preparation for going to DC, what does it mean to educate, advocate, and lobby? It's very important that you can understand and grasp the difference between each of these. So for education, it is any activity that a person or organization undertakes to educate public decision makers, policy makers about health or social issue. So this is very factual and objective based. You don't want to give your opinion. You're simply supplying them with facts. So an example of this in relationship to Kentucky, where we're from, is 1 in 5 of our children in Kentucky are obese. We're simply saying this is the fact, and we're saying, wow, that's crazy. You should vote this way on this fact because of the fact that children are obese. Just allowing them to have these facts so that they can then say for themselves, you know what, this is an issue and we need to do something about it. And the thing about this is, we can all educate. There's no restrictions on this. Okay, so move on here. We then move into what does it mean to advocate. So advocacy is any activity that a person or organization undertakes to influence opinions and or actions of public decision makers, policymakers, and executive, legislative, and even judicial branches about a health or social issue. Once again, a little example in relationship to my life is, as Jerica so kindly mentioned in my bio sketch, I work as a nutrition navigator for a peer-based program on campus. So I speak on behalf of students. So they can come to me and say, we would like, more healthier options in the campus dining halls. They don't have this kind of fruit. Is it possible for us to get it? Things along this line. So I can then serve as a liaison between the student as well as Sodexo, which is our dining service on campus that, provides these meal options for us. So a way to show how through advocating you can then also, results in the end. On to lobbying. Lobbying is advocacy plus asking. You're allowing them to have these statistics of these problems, but then you're also asking them to take a stance on it. Your end goal is to influence legislation. So very important to know, what the difference is, as well as what you as a person then can do. which will then lead us into our next slide of, do I educate, advocate, or lobby? It's very challenging, but it's very important to know not to cross lines. So in order to do this, you really need to know what your restrictions are. For advocating, as we mentioned, everyone can do this. Most university, faculty, and nonprofit organizations can educate as well as advocating. Any private citizen may also lobby, and with this, they can use their own letterhead, their own time, computer, as well as their own finances. And so typically, faculty at private institutions or profit organizations can educate, advocate, and lobby. So a quick example of this is, Dr. King here. So she's very passionate about public health and all the issues that go along with these health-related disparities that we have within our community in Kentucky. So she has to be very careful. When she is Dr. King in the sense that she's related to U of L, she's allowed to educate, but she is not allowed to fund. She's allowed to educate, but not lobby. So she has to look at how will her actions later on come back to her. So in her free time, Dr. King can do all the education she wants. She can do all the advocating she wants, as well as lobby if she does choose so. So once again, just to give a little recap, it's very important to know what restrictions are, as well as what the programs you're affiliated require of you.
And this is Christy King. I also check with my supervisors for our actual university policies regarding education, advocacy, and lobbying. So you may want to check with your supervisors on these things prior to coming to DC, just so that you have all of your questions answered. Okay. So when do we get to, why, how, what, to whom, and when do we get to educate, advocate, and communicate to our legislators and policymakers? First of all, why do we advocate for public health and public health education? Because frankly, we are people who know the health issues. We are living in the communities that we serve, and we see the health issues on a daily basis. I'm the principal investigator on a couple of different projects where I work with elementary school children on a regular basis in their school districts with nutrition and physical activity programming. I know the facts, I know the data that I collect. I also work with community organizations on addressing social issues that impact public health. So I'm on the ground collecting the data and conducting research around these public health issues. It's up to me to educate our policymakers on the data that I've been collecting over the last several years while here in Kentucky. So how do I communicate with my decision makers or my policy makers? I send a lot of emails, I send a lot of letters, I make a lot of phone calls, and I even schedule one-on-one meetings in their local offices, in their home offices, and obviously when I come to Washington for our annual summit. I am allowed to send UL letterhead when I'm educating our policymakers on some data that I've collected and the results from that. If I happen to want to talk to a policymaker on a specific piece of legislation, I send it my email communication from my home computer with my personal email address. So realize that you can wear two different hats as a private citizen and as a university employee. So what I say to our policymakers or decision makers when I want to communicate with them, honestly, I promote my students a lot. I send our policymakers links to student presentations. I send examples of peer-reviewed publications, maybe that I've written or that someone else has written that involves public health. Anytime one of the professional organizations that I am affiliated with has a new position statement, I may copy and paste that into an email and just say, hey, the new position statement on the importance of recess during the school day. Check this out. Here's the link to the new position statement. I invite policymakers to come to my students' class presentations to a community-based event that, I had a pop-up just come onto my screen. To come to a community-based event in which my students are presenting some data. I also update policymakers on some new results of research that I've been involved with or some new findings of the research. So who do I contact? I'll contact anybody. My goal is to develop a personal and professional ongoing relationship with any of our decision makers. I would love it if they would pick up the phone or send me an email and say, can you help me on this particular, understand this particular piece of information, or what is your opinion, your professional opinion on a public health issue? So I've communicated regularly with our two senators, Mitch McConnell and Rand Paul. My congressperson in my district is John Yarmouth. However, I have students who live in other districts, and we communicate with their legislators, Housers in Whitfield. I send regular updates or letters to individuals. At the state level, in fact, tomorrow is our state's Children's Advocacy Day in Frankfort at the Capitol. Eva and I are going to talk about the importance of children's health issues in Kentucky. We're meeting with our Secretary of State. We're meeting with some of our state senators and some of our state congresspeople. We're also meeting with the Kentucky Department of Education to talk about health policies and health research here in our state. Also communicate regularly with foundations, businesses, city councils, school boards, principals, teachers about the importance of health education, and health-related policies. And of course, being a University Louisville employee, I update my supervisors on the work and the health-related issues that are going on here in Kentucky. When do I advocate and communicate? Pretty all the time. My key goal is to be polite, personal, and persistent. We always don't have to have the same viewpoints on public health issues, but the goal is to be a safe focal away for any of our decision makers to feel comfortable enough to pick up the phone and call me and ask me for my professional advice on a public health issue. Oh, and a picture of Ime and myself and Clayton last year at our undergraduate research day at the Capitol, where Clayton presented some after-school children's health behavior data or results that he analyzed and met with our policymakers. So, what are we getting into in the next couple of weeks when we come up for the 17th Annual Health Education Advocacy Summit? Well, obviously, the purpose of the summit is to increase the capacity of us professionals and our students to engage in effective advocacy for health at our state and our local levels. My main goals for the summit are to network and collaborate with other health educators. That is the key thing that we can take away from this upcoming summit, is to get to know other people, form some really strong bonds. We get to learn and practice advocacy skills while at the summit. We learn about the issues actually facing our nation. We get to learn about the policies that can impact health at national level. We get to learn who are the key players at our federal, state, and local levels. And we actually get to do advocacy when we go to the Capitol on Monday.
In order to have the best trip possible to DC, there are a few helpful things you can do leading up to it. So the first thing is making sure to schedule your appointments for Monday, February 24th. So you need to first coordinate with your state captain, do some background homework to figure out who your senators are, which is 2 per state, as well as who your congresspeople are, which is really dependent on how many constituents within the district. Information that would be helpful to have would be email information, as well as legislators' phone numbers that you can then call them to reach them. This is very good to have just in case on the day of your actual appointment, if you're running a little bit late or anything, get lost, you can head and let them know that you are on your way, that you're just a little bit behind. Another helpful thing to do would be to learn about your legislators. So helpful information to know would be political party, committees they're affiliated with, their past voting history, which is a great thing to know so you don't walk in asking them to support something that they clearly do not support. Also, you could figure out their view on health, social issues, as well as government, and then years in office. Information to provide be some research about your state or district. So, for instance, we would provide them with information along the lines of 60% of children in Kentucky do not get 60 minutes or more of physical activity a day. So this helps paint a bigger picture of an existing problem, which can tie back to our first health responsibility of assessing community needs. By allowing them to know that 60% of children don't receive physical activity, hopefully it will help them formulate a picture of their demographics they're dealing with and have additional health facts. And by sharing things that you're involved in, such as programs that you're working on, so on our last visit last year, we shared with Senator Rand Paul, Dr. King is working on a project at the Mead Activity Center. Just to give you a little background information, the Mead Activity Center is a community-based, multi-level health promotion intervention. So it's really focused on allowing children to have a safe after-school program to enroll in. And it's funded through the Social Innovation Fund, which Dr. King is the principal investigator. And additionally, it helps develop coalition infrastructure to provide and improve public health education and interventions. So when we provided this information to Senator Rand Paul, great thing is they then later followed up with us to let us know that they were interested in planning a visit. So if you don't give them these extra information, they're never going to have that opportunity to come and actually visit and see firsthand the programs that you're working on. And a great way to illustrate that we're not just talking about this. We are actually in our communities working towards doing our part to provide health education for people. Okay, so this keeps in line with what to do leading up to the visit of trying to identify who your senators are and who your representatives are. So you can go to this first website here, which is actually the coalition online link to help you find your state legislators. And it'll have helpful information, such as here we have a picture of Senator Mitch McConnell and Senator Rand Paul. And it will say, here's Senator Mitch McConnell's Contact Me button, where you can then go to follow up, if you have any questions you want to ask, or to invite them to meet with you one-on-one. As we have Representative John Yarmouth's picture here, which is the same thing, the contact page of how to figure out the best route to go about setting up a meeting with them. So it would be helpful to include an example, an invitation that we sent out last year. So we highly encourage all of you attendees now to to use this template if you would like, or use some kind of version of it for your own invitations. So, first we can kind of address mailing a hard copy invitation versus sending an email. We decided to take the route of going with an email, just, keeping in mind with the shift to, paperless invitations, everything being technology-based, as well as it's also a very time-friendly way to try to get a response back. And so first we began with our information of who we were, as well as where you could contact us, the date, make sure you're addressing the person with the correct title, such as Honorable John Yarmouth, and then make sure that you have the address correct. That's a very big part of it. You're not going to be able to set up an invitation if you send it to the wrong email address or wrong address in general. We first began with talking about why we are contacting them. So say we will be in DC on this date and this time, as well as who will be with you. So if it's not just going to be you, include there'll be some other student with me, we're health advocates, things along those lines. And during your time there, ask that you would like to request a visit with them, as well as what are some of the topics that you will discuss during this meeting. And then finish it up with finally asking them, will you be available to meet with me on this date, as well as I can provide you with any additional information you would like, such as a bio sketch, which could be nice to allow them to know a little bit about you and who they'll be meeting with. And then finally wrap it up with, some kind of salutation and your information, name, phone number, and email address. And there I will actually be sending it out, which is very exciting for me. I kind of got roped into it to kind of just help out Dr. King, and she actually sent last year. So this year she's getting a little bit more responsibility of taking reins of it, and I'm very excited. So hopefully able to make her proud.
You will. You already do. So this next slide is very important for us as health educators and health advocates to know about our legislators before we schedule meetings and before we actually meet with them. So I'm just giving examples of the 3 meetings that EA and I are hoping to set up. Our 2 senators are Senator Mitch McConnell and Senator Rand Paul, and our congressman for our district is John Yarmouth. So I just hopped into their web pages and copy pasted a few bits of information about what's going on in each of our senators and our congresspersons' key issues pages. So, for example, you really want to know what committees your congresspeople are serving on. So you can see at the bottom of this slide, Senator Rand Paul is a Republican, and he serves on the Foreign Relations Committee, the Health, Education, Labor and Pensions Committee, Homeland Security and Government Affairs Committee, and the Small Business and Entrepreneurship Committee. We also, on his webpage, you'll see that he is seriously thinking about running for the 2016 presidential race. So these are really important, I believe, pieces of information to know when we go into our legislators' offices. I like to look at what their previous voting history is, what types of issues they're for, what types of issues they're against. Do they support certain pieces of public health policies that have been enacted, or do they not? So understanding what the background is of my congresspeople, when I go into a meeting with them, I'll know what some tricky topics might be. I'll know how to frame my message lightly, personally, yet persistently, so that we can really have a good conversation, a good objective conversation about public health. So I really encourage you to do your homework on your senators and your congressperson before you actually schedule your meetings, and especially before you go into your congresspeople's offices to meet them about the asks that we're going to make when we come to Washington. So what are our legislative priorities for the upcoming summit? Well, we're still determining those. We had a meeting yesterday with several of the coalition's representatives, and hopefully within the next several days we'll have voted and put forth our priority issues. What I can tell you is that these were the three priority health issues that we went to Washington for with last year. Last year we wanted to talk about the importance of prevention and health education. We talked about the importance of health equity being addressed in all policies, and we also talked about the importance of school health, specifically health education and physical education being listed as core academic subjects through the reauthorization of the Elementary and Secondary Education Act. We're still working on our priority health issues. They are soon to be announced. So this brings me to this next slide. As health advocates, need to take into account several different factors when we're meeting with our legislators. We need to know what's going on in our nation. Therefore, we need to know what's going on in the news. We need to watch and listen and read the news daily. We need to listen to the news in a variety of news sources from a variety of viewpoints. We, like health, need to pay, obviously, special attention to the cost of treatment, prevention versus treatment. Other hot topics in the news are women's health, reproductive health, the economy, obviously, and jobs, because those too impact public health. Gun control is a hot topic, academic readiness, military readiness, and mental health. We're experts in a lot of these areas, and a lot of these areas are receiving big press these days. So stay on top of what's going on in the news. Next, we need to, once our health education advocacy legislative priorities are announced, probably within the next few days, we need to educate ourselves on those legislative priorities. When I go to educate myself on health issues, I go to our professional organizations' websites. I look at pages such as our Take Action web pages. So if I wanted to learn more about the Affordable Care Act, I'll go to the APHA website or SOPHE's website. If I want to learn more about clean air, I'll go to APHA, and so forth. So here are some examples of professional organizations that have really nice, concise, educational position statements to help us learn more about our legislative priorities. Next column, you'll see, obviously, we want to align our message with legislators' priorities. So again, look to see which committees your legislator serves on. Look to see if your legislators are sponsoring particular pieces of legislation, or if they are co-sponsoring a particular piece of legislation. Look on your legislators' issues web pages to see what types of issues they are interested in. And obviously look on their current events or their news statement web pages to see what types of issues they support and what types of issues they don't support. And lastly, most importantly, remember that we are the experts in our jobs, in the research that we conduct, in the classes that we take, and the jobs that we do every day. So some of us have special areas of expertise in health disparities or access to prevention and treatment. Some of us have special areas of expertise in health outcomes like diabetes or cardiovascular disease or obesity. Some of us are expert in health behaviors like physical activity and nutrition or smoking or medication compliance. job is to politely, professionally, and persistently align your message with your decision makers' priorities. So try to keep all of these things in mind when talking with your legislators. Okay, so here is Ime. Oh, never hears me. So as I said earlier, my area of research is in the health of Kentucky and Kentucky's children. General background information when I go to meet with our legislators or any policymakers or any decision maker. I talk about over 2/3 of our population are overweight or obese. We are the 7th highest ranking obesity rates in the United States. The American College of Sports Medicine just listed us, Louisville, my city, the 5th unhealthiest city to live in nationwide. 1/5 of our school children are obese. This isn't counting overweight children. 2/3 of our children are not physically active. 75% of our children don't participate in PE. Most of our children don't eat enough fruits and vegetables. And our young adults are unfit and unqualified for military service. Children's health advocate. I realize that children's behaviors grow into adult behaviors often. And I also realize that teaching children healthy behaviors isn't enough. We need to address the social, the organizational, the community, and the policies that impact children's health. We need to address social issues such as poverty as well. So there's a little picture of our obesity rates in Kentucky. I originally, FYI, became interested in advocacy back in 2000 when I first went to Washington to advocate for physical education programming. So now here's Ime.
Okay, so moving along, how to tailor your message. So it's great to have some kind of idea about what your main talking points are. You know, on the actual day of these visits, you want to have a whole bunch of time. So once you get in there, you want to just get right to the point to make sure that, you know, you're getting the message that you came to deliver across. So, you know, not to be repetitive, but it's just such an important part of this summit trip. You know, finding a shared interest between yourself and your message that can fall in line with what the legislator's message is very important. As Dr. King mentioned already, we are the experts in this public health field, as they are, as legislators, the experts in their field. Together, we can really serve as a resource to one another to help solve the problem of the public health issue that needs addressing. So it's really the idea of, you know, return on investment. So as a legislator, if you invest in what I'm asking of you, you know, will you see some kind of return and profit from it? And hopefully they will. You know, children are and should be our biggest investment. You know, eventually children will grow into the leaders of tomorrow and the future of tomorrow. Really, we need to try to develop these healthy skills at a young age. Moving along, you know, find something that they're interested in, such as this idea of military readiness, and form your message around that. So, you know, hopefully they will think the fact that most children out there aren't fit enough to run a mile is a problem. You know, if a child can't even run a mile, how, if they're called for military combat, will they then be able to protect our country? It's a scary thought, you know, and so if you form it in a message, it's not just an individual problem, it's a bigger problem of national security. Hopefully that is something that all legislators will be able to get behind and support, as well as moving along to, you know, prevention versus treatment. Hopefully we can get away from the idea of treating the problem as the answer, more so towards a thought of prevention is cost saving. So thinking in terms of businesses, you know, will a business want to move into Kentucky and set down roots? You know, chances are a business wants a community that is healthy, that will produce productive employees. So to allow ourselves to have a healthy, productive workforce, and once again, hopefully that is something that legislators will be able to get behind and support, even if they do not have the same viewpoints as we do. Okay, here we have 3 asks from this past summit visit. And then these here, once again, we did not formally ask them due to restrictions of educating, advocating, and lobbying, the difference between them. But everyone will be provided with a packet from the coalition that you can then, at the end of your meeting, hand over to the legislators. I wouldn't recommend that you hand it at the beginning because you don't want them flipping through it and not paying attention to what you're saying. So, definitely just go ahead and try to hand it to them at the end of your meeting so they'll be focused on what you're saying and not flipping through the papers. Just have an example of our script that we took with us. So once again, it's for me personally, it was my first time going to the Capitol. It's an exciting time, but it can also be a little bit scary and overwhelming. But I felt so much more comfortable having some kind of script that I could refer back to if ever I lost my train of thought. So first we began with figuring out who was going to do what. That way you would walk into the meeting and not fumble over each other speaking. So we split up with first having Dr. King do the introduction. You introduce yourself, stay a little bit to give them some background information. So such as we've done with Kentucky, giving the statistics of how many children are not getting enough fruits and vegetables, how many children are obese, statistics along those lines. Then we went into Clayton discussing academic performance and military readiness and why it's such a problem, as well as the legislation that could help support these problem areas. Then wrapped it up with myself going ahead and talking about prevention and cost saving. And at this point in time is when I told a story, which I highly recommend to everyone to share some kind of story. It doesn't have to be anything lengthy. For me, I told a story about how my mother is a registered dietitian. I grew up knowing the difference between eating healthy and not eating healthy. If I tried to leave for school without eating breakfast, my mother would say, "You better get back in there and eat." And so I know firsthand that I would not be the person I am today. I would not keep up with my physical activity as much as I do, or eating fruits and vegetables as much as I do, if not for my mother. But unfortunately, not everybody has this kind of role model in their lives, which is why it's so important for us as a community to get behind people to help support healthy lifestyle initiatives. So then we wrapped it up with just saying thank you for your time and asking them if they had any questions for us. So in addition to this, we include a little guide of what to maybe put in your backpack with you the day of your Capitol visit, as well as what to wear. So we encourage everybody to wear a suit. You do want to look very professional. Wear comfortable shoes. You will do a lot of walking, so you definitely don't want your feet to be hurting by the end of the day. As well as wear a coat, hat, gloves to make sure to protect you from the weather elements. In your backpack, have a driver's license. This is required, so the day of, check it a few times. Make sure you have it on you. Have your script if you do plan to do that, as well as the packet. I think business cards could be a great touch. I did not have any on our past visit, but for this year, I will plan to have some. It's a great way to network with people, and I just met so many great people that were interesting, so it's a great way to keep in contact, as well as camera and things along those lines.
Honestly, right came back to Louisville, we sent thank you letters. I sent them from my University of Louisville letterhead. Senator Rand Paul's staffer asked me specifically for some information about some research and data that was being collected on one of my projects here in the state. And so I was able to put her in touch with the actual community in which I serve. Is my understanding now that Senator Paul's office is intending, someone from his office, if not himself, is intending to schedule a visit to one of these centers. Here's also an example of a state senator that we had some follow-up information also. I really encourage you to thank your congressperson for meeting with you while in Washington or their staffer for meeting with you while in Washington. Sorry. This is all that we have scheduled for us today. Ema and I realized that we made this very Kentucky-oriented, but we wanted to give you specific examples of how we used what we know in here in Kentucky and took it to the national level. You can create your own script, your own identity of your own state when you go to Washington. So hopefully this message is transferable to you and your state, and we look forward to any questions you might have. You can contact us directly or here on the chat. So thank you.
Thank you.
Thank you so much, ladies. You can see here on the slide Christy and Ema's contact information, which will be posted. If you need to get in touch with them directly, you can contact me as well. We have a few minutes at the end here for questions. Don't forget to type your questions in the Q&A or chat box on the right-hand side of your screen. I've already seen one come up that I can go ahead and take, and that question is, how do you know who your state captain is? If you register for the summit, you will receive an email, an introductory email from me after you register, and then you'll receive another email from me here at SOPHE introducing you to your state captain. And your state captain will be a great resource to help you, guide you through the process of making an appointment, a congressional appointment, and their role and responsibility is to basically get a heads up on what are being made for their state, and if there are participants that are going to school in state but are registered to vote in another, making sure they have someone to come on a visit with them and to help with not duplicating calls and making appointments to the same congressional offices. And just in case there's another participant that has a question they want to type in, Christine, you may have a question for you. So just to double check, when you guys are talking about the difference between advocacy and educating and lobbying, so just to double check, if my salary is paid with federal funds, what is my role in a congressional Hill office when I'm on a visit?
So I'll just give the example of me. I work for the University of Louisville, and part of my salary, because I'm the principal investigator on 2 federally funded research projects, I also receive salary from federal dollars. So I am not allowed to lobby. I'm not allowed to ask our senators or our congressperson to vote a particular way on a particular bill. Now, what I can do is hand our legislators the coalition packet that I receive at the summit and say, in this packet, our coalition has put together a lot of valuable information, and I'm giving this to you. Within that packet, though, are the specific asks. I checked with my department chair and our university policies, and that is okay.
Gotcha.
Let me tell you this, if I was coming to SOPHE as a private citizen and I was not bringing students with me, I would be able to lobby and make a specific ask.
Gotcha.
Some of the faculty are choosing to do that, so we can wear a variety of hats. But since I'm bringing students and I am being funded, then I cannot lobby.
Very good. Questions posed to both of you, back to, I guess, like a procedural question. So you went through the process of how a bill becomes a law. What are the chances of a bill becoming a law? Do most bills become laws? Do they not? Any information or insight you can provide for people who are participating in the summit that may have that question?
I honestly don't know the acceptance rate. Really good question. I wouldn't, if the acceptance rate, that's I'm talking about a journal publication. If the acceptance rate is not high, I still would not let it deter me from being about communicating with my legislators about the importance of public health and public health issues. That's the only information I can give you.
One question from a participant, they have a non-driver's ID. They have an ID, not a license. Will that serve the same purpose?
Yeah, this state-issued identification card, then yes, that can serve as your license. That student actually that ran.
Okay. Very good, very good. We have us at 2:30 on the dot. We have reached our time for our webinar. So if anybody has any other additional questions, again, they can reach out to me or our presenters directly. Once again, today's webinar was recorded and will be archived within 2 weeks on SOPHE's core website. Please take a moment to complete the brief feedback form that will pop up in your internet browser following this webinar. And if you are interested in continuing education credits, please also visit SOPHE's core. A huge thank you to our participants and all our presenters and our participants for taking the time to participate on this webinar today. Thank you all so much. This ends our session, and I hope you all enjoy the rest of your day.
Bye-bye.
Thank you.